Hello people, welcome to my YouTube channel. This is Samanvitha here. And today I thought I'll share about the FRCR 2B exam, mainly from the day of booking till the day of exam, and then a little about my journey with this session. So when you go to book the FRCR 2B exam, as you all know, now you need to log in through the RCR exam hub. If you've already completed your 2A, then it will show you the dates of the upcoming 2B exams, and then you can choose and you book it. While booking, again, you only need to book the reporting component of this exam, which will automatically book you for the oral component as well. And the money that you pay is for the entire exam. Congratulations if you've booked your exam. Getting a slot in the city of your choice is in itself a very big deal. Coming to the exam. Now, so the reporting exam, which is the first day of your exam, will be usually on a Friday. Now, this session is usually same for everybody sitting in that time of the year. So you have the long cases followed by the rapids. Now, coming to the long cases. So these are usually 6 long cases that need to be answered in 75 minutes. That gives you an average of around 12 minutes per case. Each of these cases would include more than one modality or just one modality also, but they can have like an X-ray, a CT, an MRI, a radionucleotide scan, all for the same case or for different cases. When you type in for each of these cases, you will have 5 boxes to type. One would be the observations, then interpretation, then the principal diagnosis, the differential diagnosis, and finally the management. So when you type in the management, it also includes the investigations that you would conduct for that case. Now, like I said, it gives you an average of 12 minutes. And I would suggest that you try and finish this within 10 minutes per case and then come back and review whatever you've written for the rest of the cases. The little trick that I used is when you're well prepared, that is towards the end of your exam, what helps is starting off by writing the principal diagnosis. Now, usually, at least for 3 to 4 cases, which may seem pretty straightforward to you when you're well prepared, it makes it easier to get the diagnosis when you scroll this case once or twice. Now, when you do that, you start off with the principal diagnosis, write the differential diagnosis, and then go and write the management. Then, with the time left, write the observations. And what happens usually is, as humans, I think we tend to try to write a lot in the observations box. It's also a big box in itself. So this avoids doing that and allows you to write whatever is needed to get the amount of marks that allows you to pass, and also do it within the given time. So this is what I did, and I really hope it will help you as well. The resources for the longs. Now, there are many books, a few of which I will list within the description box. And there are also online resources. And the courses also have these longs practice cases. So the online resources which are helpful, which I found really helpful, are the FRCR longs and revised radiology. FRCR longs, again, you can buy 60 packets. I think it's 40 packets or 22 packets. So you can do that. And revised radiology has 30 packets. In each packet will have 6 cases, and you can time this by yourself and attempt them at home. I would suggest that you try typing at least the last 30 cases when you're preparing, just so you know what to write in which box and not to be confused about that. And then coming to the rapids. Now, the rapids is a 35-minute long exam in which you need to answer 30 x-rays. Now, what do you need to answer? The trick here is that 15 to 16 or 14, mainly they say an average of these are normal and the average of them are abnormal. So the trick here is to practice hundreds and hundreds of these rapids, and there are many sources that allow you to do that. The aim here is it reflects the day-to-day A&E reporting, and I think it's really important as a radiologist that you learn to do this. These x-rays can range from the skull, chest, abdomen, pelvis, spinal, and limb radiographs. And they can be fractures, they could be findings like pneumothorax, pneumomediastinum, etc. And all of these resources will reflect these similar kind of cases. The resources, again, there are many books. And apart from that, the online resources which are helpful are the RAD exams and revised radiology again. So you can buy these resources on RAD exams. Again, you can buy packets like 30 or 60, and revised radiology has around 80 packets. So you can do either of these, and also do, if you would like, you can look at these books as well that I've listed down. Now, before you start even reporting any of these resources, you should read the Accident and Emergency book by Nigel Raby. So this book is excellent. It lists out, how to read the X-ray, how do you go about, what are the review areas in each of these X-rays, from the skull up till the limbs. And I suggest that you read this at least 3 times before the day of your exam. Another trick and tip is you write down what are those findings that you miss commonly. And I did this I took a notebook and I would write chest X-ray on the first page, and I wrote down those things that I usually miss. And these would be like an apical pneumothorax, acromioclavicular joint dislocation. That would be something I don't really look at, and I used to tend to miss. So you can write that in each of the page, like say chest X-ray on one, then next I would write like, abdominal X-ray and the pelvis. And similarly, I made these notes for each of those pages in the book. Like it just hardly takes around 12 to 13 pages. And I would just look at them before I do the packet of the day, and also the day of the exam. In the morning, I just had a look and then went into the exam. And I found that to be quite helpful. So once you're done with this reporting component, which is on a Friday, and after that, you have the oral component. Now, the oral component is variable in the sense that it can be on any day from the next week, Monday to Friday. And each of you will have a different session and different examiners also. So this exam, again, would be 1 hour duration, the oral component. In this 1 hour, you spend half an hour in the first room and half an hour in the second room. In each of these rooms, there are 2 examiners. And what happens is both of these examiners don't really know what cases the other one has got. So I found that it's extremely fair in that. So when examiner X showing his or her cases to you, examiner Y is the one who will be marking you. And you and the examiner Y will be seeing this case for the first time. And I found that this is an excellent way to examine someone, especially with radiology, because there are many findings that one doesn't really see right at the beginning. But given the way that we look, given the observational skills, given how we look at the review areas of cross-sectional imaging and X-rays, one would finally do get to that finding, especially if one is a good and safe radiologist. So this is an excellent way of testing that. And the examiners also take 15 minutes each. So first examiner X shows his or her cases, Y will examine you and mark you, and later they switch, and the next 15 minutes the opposite happens. Now, each of these cases would be marked out of an 8. So the question usually that the dilemma that all of us have is, how many cases do we answer to know that we have passed? So there is no such definition of how many cases you do. But I'd like to say that it doesn't really matter, because even if it is one case, each modality of that case is marked out of an 8, and then it is averaged in that room. So ultimately, all of the mixing in one room for half an hour comes to a score out of 8. So it's okay if you've, not really found 1 or 2 cases, but you've gotten the other 2, like say a 7. So this is still averages out, and you do pass in that room. Then you go to the next room, and the same thing happens with 2 other examiners. These exams are usually held on MS Teams, and they will ask you to scroll and practice scrolling right before the exam starts in each of these rooms. So you don't really need to worry about any technical difficulties during the exam. It will all be sorted out for you by the people there who will help you. So this is about how the exam will be conducted. Now coming to the total score. So like I said, the oral component, each room is scored out of an 8. So 2 rooms together for the oral component becomes a score out of 16. Now the rapids, again, for 35, minutes, 30 x-rays, again, would be scored out of an 8. Now, how is that? So with each of the x-ray, you would be marked out of 2. So for 30 x-rays, the total score would be 60. Now, to get a 6, if 60 would give you a score of 8, then to get a score of 6, you need a score of 54, which again reflects back to a score of 27. Now, this is the tricky one. You can only make 3 x-rays wrong in the rapid reporting. And this is why, all of us get really scared, and it needs a lot of practice to master this. And if you're well prepared, in fact, you would be over prepared when you practice so many, you tend to overcall them. So that is the trick here, to not overcall something like a hairline fracture that appears like a hairline fracture, and be really careful. Then coming to the longs. So again, longs, each case, the 6 cases, each case is marked out of an 8, and all of them are averaged to get a score of an 8. To pass each component, you need a score of 6. Okay, so let me again summarize that. So 16 was from the oral component, 8 from the rapids, and 8 from the longs. The total score is 32. The magic number to pass is a 6 in each, which is 24. So you need 24 to pass this exam. And you need to pass at least 2 components out of these 4 components in order to pass. So it's okay if you get a 5 and a 5 and a 7 and a 7, you still pass this exam. So don't be disheartened once your Friday is over and you realize you may have overcalled, 2-3 x-rays. Do not be disheartened, because your Viva can still go excellent and you will still pass this exam. Now coming, I hope I've covered everything about the exam. Now coming to my journey. So I took about 3 months to prepare for this exam. During this 3 months, I was working part-time. That gave me a lot of time to go through these resources. I used Revised Radiology combined subscription, which had both Viva, Rapids, and Longs. Out of these 3, I found Viva to be the most helpful. It was held on 3 days of the week, and they would have a monthly Viva as well. And long cases also are extremely good in Revised Radiology. Now, Rapids, again, it didn't seem really helpful to me, but people do say that they are really good as well. And you can check out both RAD exams and Revised Radiology, and you can decide that for yourself, would be my advice. Now, coming to the other resources I used, so I would attend rituously attend DKT seminars and John Curtis classes in the week. I was looking forward for Dr. Sandeep Awal's Radiology Vibes classes, but during my session, they weren't frequently held. And apart from this, I also attended the FRCR 2B ARI course that was held in Hyderabad, India. This course, again, was extremely enlightening. We had examiners from everywhere who would take Vivas for us, which exactly mirrored the real exam. It was again held on MS Teams, which is again very helpful. And they also had multiple sessions of long cases and rapids, and the software that they used was very similar to the real exam. And so after 3 months, on the day of the exam, I found that the longs were very tricky in terms of time management. Now, when you're reporting at home, 10 minutes is seems very long. I could actually finish all of the longs within 60 minutes when I was well prepared in the last month. But in the real exam, I did find it a bit tricky and to manage time. So that would be an advice for me. If you can manage it better, that would be helpful. Rapids time again was not an issue in Rapids, but I did overcall a few x-rays. Then coming to the Vivas actually went really good for me, both the rooms. And again, I'm bound by confidentiality, so I cannot really share what cases I got. But ultimately, it is to assess if you're a safe and competent radiologist. And my tip here would be to think of that Viva session as a session like you're just discussing with a senior or a colleague at your hospital, So just be really relaxed, and whatever you're thinking, think it out loud. Like if you're not able to see anything, just say, I am looking at the liver, but I don't see anything of concern, and go down. Now, it is frowned upon to scroll a lot of times because it may be irritating. So take your time, be slow, just scroll once, do your methodical review of the cross-sectional imaging. And if you see something, let's say you are scrolling somewhere, you've scrolled once, you saw something in the rectum, but the scroll came back to the liver and you saw something there. So just think it out loud. Say, I'm seeing something there. I would like to go back and review that area. Meanwhile, I'm just looking at the rest of the organs and I don't see anything, in the rest of the abdomen or pelvis. So just think it out loud. Just keep talking. Show that you can be an examiner that they'd like to have on their team in the hospital. Just be relaxed and just discuss like a radiologist. So this would be my advice, and I hope I've covered it all. If you have any more questions, please leave it in the comment box and I will get back to you. And something I want to tell everybody is you've got so far already. You've done the FRCR 2A. You have enough knowledge of radiology, and whatever experience you have till now, you can make use of all of that and really crack the FRCR 2B exam in your first attempt. And you can and you will do this. So all the very best and good luck.